To be honest, I found it quite actually just personally difficult digging into the details of what's been happening. Since I got back, it's obviously been quite hard to deal with the feelings of having of left really and no longer assisting. So I'm not really across all the details, but I'm aware there's been a big uptick in civilian deaths due to bombing from the air of the densely populated Gaza Strip.
And I certainly appreciate you coming in to speak with us in spite of how that must be making you feel. So thank you again. Tell me about your experience when you were there just some weeks ago. I think the blockade was just in its first week at that point.
So I was there in February and March. I worked or volunteered in 3 hospitals, 2 in Gaza City and 1 in Khan Yunis. So they were Nasser Hospital, Shifa Hospital, and Al Ali. It's got a few names, but Al Ali is what I know it by. And working there, the things I noticed were the high number of civilian casualties. I wasn't aware of any military or militant activity while I was in any of those 3 places. Every hospital that I volunteered at has been damaged or partially destroyed by the IDF and has severely limited its ability to care for the population. And the other things I really noticed were the very junior doctor cohort, excellent doctors, excellent nurses, doing the best they can. But conflicted with their need to look after family and things as well. A lot of them have been displaced multiple times. A lot of the more experienced doctors have been displaced or left. So quite a junior cohort, but working really well. The other thing I really noticed was the lack of resource, so human resource, but also pain medications, simple things like asthma inhalers, insulin, antibiotics, all severely limited while I was there. And obviously there's been a complete blockade of all humanitarian food and medical equipment since I've left, and that situation's only gotten worse. Sadly, of course, that means that hospitals that are still functioning are finding increasingly difficult to care for the large number of civilian casualties that they're receiving.
And I want to explore that more in a moment. What we see here, Dr. Holden, appears to be a sense of absolute hopelessness there and absolute devastation. What were you hearing? What were those people that were seeking help from you? What was the sense you were getting about how they were feeling?
Yeah, and it's actually been one of the hardest things about coming home is feeling that I've left them to it, really. The doctors and nurses did feel, to some degree, protected by the presence of foreigners. They felt that they were less likely to be killed at work, frankly, if we were around. So I feel that abandonment. The population there does feel hopeless. The population there is unable to protect themselves. They don't have safe places to go. Often when they are told to flee to a safe area, that place is then attacked. And they are unable to really influence the politics on the ground there. So we're told that they must remove Hamas themselves or whatever, and it's just not realistic or possible there. The civilians are just caught up in the middle of this with nowhere to go, and they feel abandoned by the world. They feel like the ethnic cleansing, the genocide that we're seeing there is actively aided and abetted by Western nations.
What would you say to the politicians and the leaders who have the ability to influence or create change with this situation on the ground?
I would say that they need to just see the Palestinians not as politics, see people, see children, see adults who don't know where to take their kids when they're injured. See the people who can't get their day-to-day medications, see humans, forget the politics, do what's right. I think the politicians do know what's right, and we need to not just talk the values and say who we support and say what we think is right. We need to show the Palestinians, we need to show the world that these kind of attacks on civilians and healthcare infrastructure are not acceptable. We can't just talk that, we need to walk the walk.
And just finally, you touched on the healthcare equipment, aid and medication, that much of which has been caught up in this blockade that's now stretched into its 10th week. What sort of priority does that need to be able to deliver primary health care?
So on a good day, Gaza is dependent on huge numbers of imports of medication, equipment, and other things that you need to run a hospital, including fuel, because the electricity's been cut off. So diesel is required to power generators to run a modern hospital. That on a good day needs a massive input. Now, with the decimation and the total destruction of many of the hospitals, it's a massive effort, an increase in the amount of aid, not a blockade that's needed. And we need to not just satisfy the needs as they are right now, but to start to recover from the this punitive blockade of medication and equipment that's been in place now for over a month.
And Dr. Chris Holden, who volunteered with the Palestinian Australian New Zealand Medical Association in Gaza, thank you very much for joining us and for sharing your thoughts and observations.
Yeah, thanks for your time, Dan. Thank you.